Hey, Mom. Hey, beautiful.
Okay. I'm ready. Okay, the first thing I'm going to go over is nephrotoxic. That's something that kills nephrons. You know, the nephrons have to do with the kidney.
Right.
And examples of things that do this is aminoglycosides and NSAIDs. So once we learn the drugs, we'll know, exactly. The nephron was the most basic structural and functional unit of the kidney. The bladder, it has 3 layers called the detrusor muscle. It's innervated by the autonomic nervous system. The autonomic bladder is also called the urogenic bladder. What that means is that the bladder, they may use the bathroom by reflex. The bladder has no innervation. This happens to babies and paralyzed people, such as paraplegics or quadriplegics. Male urethra, 5.5 inches to 6.5 inches long. When you're catheterizing them, you insert it to bifurcation. Female urethra is 1.5 to 2.5 inches long, and because their urethra is shorter, they're more at risk for UTIs and at risk for incontinence because it's short. A catheter is hard to put in when the sphincter is closed. Remember that. Micturition, another word, is voiding. Voiding is urinating, peeing, whatever you want to call it. The desire to void in an adult happens at 150 to 250 milliliters. Urinary incontinence, that's the involuntary loss of urine related to an increased abdominal pressure, and this can happen when you cough or sneeze, which is called the stress incontinence. Stress incontinence happens when you cough or sneeze. And actually, stress incontinence can be after many childbirths or childbirth itself, just different things.
So when you cough or sneeze, you kind of excrete a little bit of urine.
Yes.
So that's like, okay. So you cough and you pee on yourself.
Yes.
Okay.
And frequency of urination. That's how often you go. Urinating less frequently is a risk for a UTI or a kidney disorder.
Okay.
Urinary retention. Urine is not excreted fully from the bladder. This can be because of meds, enlarged prostate, or vaginal prolapse. Women never fully empty their bladder, but you don't want too much left in there. Newborn bladder holds 15 milliliters. After the first week, a newborn should be voiding every 2 hours, and you're supposed to count their diapers. Toilet training. The best time is between 2 and 3 years old. The child needs to be able to hold their urine for 2 hours, recognize that they have a full bladder, communicate the need to void, and control urine until they're on the toilet. Regression of toileting while in the hospital is normal in children, and it only lasts short term. Enuresis is bedwetting. They have medication for bedwetting. Bedwetting is not a problem until the child turns 6 years old. And then nocturia is bedwetting during the night. That stops between 6 and 8 years old. That's the normal. But meds for bedwetting is the desmopressin. It's an antidiuretic. Effects of aging. They have a diminished ability to concentrate their urine. Bladder muscle tone may be reduced. It may reduce the capacity of the bladder to hold the urine, so they may urinate more frequently. Decreased bladder contractility. This makes them have urinary retention, which makes them have a UTI. Neuromuscular problems, or like dementia or something, can affect their urine. Meds, such as diuretics, because it calls them urgent continence, where they have to go, like really bad. And sometimes they may not make it to the toilet.
Do the dance like they got to go really bad again.
Sedatives and tranquilizers. It diminishes their awareness of the need to void. Reasons for low muscle tone or decreased immobility, aging, catheters, childbearing, menopause, which is the loss of estrogen. That's the reason, the loss of estrogen.
Mm-hmm. That's the reason for menopause?
No, for decreased muscle tone.
Okay.
Also, fever and diaphoresis. Diaphoresis, like sweating, it decreases their going to the bathroom voiding.
Yeah.
Food and fluid intake. Dehydration, kidney reabsorb fluid. The kidneys reabsorb the fluid during dehydration, and the urine is more concentrated and they void liquids during dehydration. When they have fluid overload, the kidneys excrete a large quantity of diluted urine, so it's kind of like watered down. Caffeine has a diuretic effect. It's going to increase urine production. Alcohol does the same thing as caffeine. Sodium. With sodium, you have sodium and water retention. It decreases your urine. Foods such as asparagus or onions affect the odor of the urine, make it smell bad. Beets affect the color. I'm not sure what color it turns it. It didn't say. A high specific gravity and a high bun is equal to dehydration. Exercise increases the metabolism, and it helps you get the optimum healthy urine production and helps you with elimination. Catheters cause people to lose their bladder tone because the bladder is not being stretched by filling up with urine. If a patient has no urine output, then you need to suspect acute renal failure. Also, when you think of body metabolism, fever, 98 to 103, they may start shivering, and that's normal. If they do have a fever, they may feel like they're cold. So just remember not to remove the covers and give them the towel out if it's ordered. Diuretics, those are the water pills. They treat hypertension and other things, and they prevent the reabsorption of water and certain electrolytes. Cholinergics stimulate contraction of the detrusor muscle and produce urination. Anuria. That's when they're not urinating. That's because their kidneys have shut down, renal failure, and this is less than 50 milliliters in 24 hours. Dysuria, pain or difficulty. Frequency is an increase in incidence of voiding. Glycosuria, sugar in the urine. Oligouria, scanty or diminished amounts of urine. This is less than 400 milliliters in 24 hours. Nocturia, they urinate at night a lot. Polyuria, excessive output, diuresis. Proteinuria is the protein in the urine is indicative of kidney disease. Pyuria is pus in the urine and it's cloudy. Suppression stops the urine. Urgency, a strong desire. The adult kidneys produce 60 to 120 milliliters per hour. Urinary retention is most common in men aged 50 to 60. No protein, no ketones, no glucose should be in the urine. You need to know the bun level, the regular, and the normal levels indicated anything with urine, like the creatinine and all that. Kegel exercises or vaginal weights. Weights come in different ways. They can be cones, the little bend wall balls, whatever. They strengthen the muscle tone to improve incontinence and reduce elimination problems, and they help with stress incontinence. You can do those. You can do them at any time, in your car, whatever. Promote urination. You need the schedule, bladder training, privacy. The position will help. Careful hygiene to prevent infection. UTIs. The risks are the sex, when you're having sex, because the perineal area may have the bacteria move toward the front and go into the urethra. Women, diaphragms and contraceptives, total menopause because of urinary stasis and decreased estrogen, catheters. Diabetes mellitus is a risk for UTI because the glucose in the urine is a medium for bacteria and elderly people. Transient incontinence. It comes and goes and appears suddenly and lasts 6 months or less, and is related to confusion, illness, or medical treatment. Stress incontinence. That's when you sneeze, cough, and it's after childbirth or stress on the body. Mixed incontinence is a mixture of 2 or more incontinence. Overflow incontinence is the result of overflow or distension of the bladder. The bladder fills and dribbles occur. Functional incontinence is the inability to reach the toilet. Reflex incontinence, that's the baby and the spinal cord injury. They empty the bladder without the sensation of the need to void. Total incontinence, continuous and unpredictable loss of urine. It could be after surgery, trauma, or malformation. PVR, that's the post-void residual, is urine left in the bladder immediately after voiding. And you can measure the PVR by putting in a cath or ultrasound. A PVR of less than 50 is good bladder emptying. More than 150, they need a cath. And that's it.
Yay!